Thank you to our 2021 industry sponsors, Little Green Pharma, Zalira Therapeutics, and MedLab. Without your very kind assistance, we would not be able to bring these free webinars to the people who need it most. Thanks for taking the time to join us for this webinar on medical cannabis and how it may assist with cancer symptoms and in palliative care. I'm Jason Jordan, and I'm a Director of Medical Cannabis Research Australia, as well as being a prescribed patient of medical cannabis. Now, I'm one of the fortunate ones who knows exactly how well this amazing plant can help. Whilst I use it for treating the symptoms of multiple sclerosis, one of the main conditions it's helped me with is pain. And I understand that is one of the many challenges of dealing with cancer and in palliative situations. Medical cannabis has allowed me to come off 7 different daily medications, including painkillers and antidepressants. And that's part of the reason I'm involved in these free educational seminars. I want more people to learn that medical cannabis should not have a stigma attached to it. It works and it's safe. And that said, I'm not a doctor, so you must consult with your own medical care provider to see if it's suitable for you. But if they won't even consider it, don't let that be the end of it. Find another doctor. This webinar has a number of cannabis experts and a prescribed patient. At the end of the presentations, we will have a Q&A session, but because there's so many attendees, the Q&A works by letting anyone submit a question, and then everyone can vote on what questions should be answered in the time we have remaining. Now, just for housekeeping, the fire exit is over there, and you can find the toilets just down the corridor. Let's get on with it.
Hi, my name's Judith Lacey, and thank you for inviting me to come and to speak to you about prescribing cannabis for cancer symptoms in palliative care. So I'm the head of supportive care and integrative oncology at Chris O'Brien Lifehouse, and I'm a palliative care specialist. I've been a palliative care specialist and worked with cancer patients for over 20 years. And I found working with cannabis probably one of the most exciting parts of my career and one of the most exciting drugs that I've prescribed, because it really is making a difference to the lives of my patients. So in this short period, I'm really just going to touch on my experiences prescribing and some examples as to the benefit of cannabis for my patients. Now, what motivated me to start prescribing cannabis was the possibility to improve the lives of cancer patients. I'm always looking for how best to use evidence-informed practice and evidence-based practice to improve symptom management in cancer patients. So it's the patient's unmet supportive care needs that ultimately motivated me. The other thing was the endocannabinoid system, and you're going to hear more about that later. But the endocannabinoid system was something that was discovered just after I finished medicine, so I really never learnt about it. But to know that there is this system in our body that assists us in so many, in maintaining homeostasis, which is, and improving symptoms, and in so many different ways, and so many is very fascinating. And I can go on, and that has really motivated me to find ways to work with the endocannabinoid system to improve the quality of life of my cancer patients. And the plant itself is intriguing, is fascinating, and the fact that traditional medicines are very much based on this incredible collection of plants and medicinal products is incredible. And the more you learn, the less you know, but the more excited I have become. And so from my experience as a clinician, I've learned about cannabis by talking about cannabis and by the referral patterns, and I have become the main go-to within our large comprehensive cancer hospital of Chris O'Brien Lifehouse for people interested in medicinal cannabis. And when we were running the chemo-induced nausea and vomiting study, there were a lot of people coming to us asking about medicinal cannabis, and so I saw a lot of patients. And so I learned through my prescribing and learnt about how cannabis fits into this puzzle of symptom management and how it perhaps is one of the missing links of how we improve the quality of life of our patients. It offered research opportunities, which I'll come to at the end of my talk, and it also enabled us to search for new ways to meet the unmet needs of our patients. So besides prescribing exercise, lifestyle change, acupuncture, yoga, meditation, I also prescribe cannabis. I prescribe morphine, pregabalin, and other drugs as well. So the most common reason people come and see me and ask about cannabis in this space are for threefold. First, refractory symptoms of advanced cancer. The second is cancer and cancer treatment-related side effects. And the third is the cancer itself. What we know with people with cancer is that symptoms don't present in isolation, and there is something called symptom clusters. And you'll hear a lot about symptom clusters in this space, and we know that people with pain often will have nausea, anorexia, loss of appetite, fatigue, their sleep will be disturbed, they may have a lot of anxiety, they may develop anticipatory nausea before their chemotherapy even happens. And so looking at ways to treat multiple symptoms with one drug or one intervention, whether it's acupuncture or medicinal cannabis, is really favourable, particularly now as we're keeping people with advanced cancer living longer with cancer. Polypharmacy is being revisited. Polypharmacy was really the mainstay of good palliative care, and I still write a chapter for the Oxford textbook on managing the last days of life, and polypharmacy still features highly because getting symptom control right and in maintaining a sense of dignity remains number one. But if people are living longer, making sure that we can improve their symptoms, multiple symptoms, particularly if we can do it with one product, really is a fascinating opportunity. And this is where I think cannabis really has a niche space in people living with cancer. And so my key principles when prescribing for symptoms in an advanced cancer patient is first understand the patients and their key concerns. And I use something called patient-reported outcome measures, as many of us are now using in cancer care, capturing the patient voice to store those multiple symptoms 0 to 10. Work out the best strategies to improve their quality of life and daily well-being. You can see this diagram here. It's a circular process of assessing, developing a treatment plan, providing evidence-based interventions, reviewing, adjusting, ensuring we use the best drug, the best systematic approach for the condition, minimise the toxicity and side effects, reduce polypharmacy, cease unnecessary medication. So if cannabis works for a symptom, I cease the unnecessary anti-nauseants that may no longer be needed. Fine-tune, review your patient. And so if I start with cancer and cancer treatment-related side effects, we actually see that people with cancer and with advanced cancer are being offered treatment really up until they die. There are a lot of people are on new treatments for cancer. There are a lot of phase 1 and phase 2 trials that people are being offered, genomic profiling of patients. And so we need to make sure that as you're on a treatment that may have less chance of working, that you're not suffering from symptoms and your quality of life is maintained from the time of diagnosis. So at the American Society of Clinical Oncology, which is one of the most prestigious meetings in the cancer world, we're seeing a lot about cannabis and medicinal cannabis role in improving patients' well-being with cancer. And this is from a presentation from 2019 that showed an improvement with cannabis in improving common cancer-related symptoms with cannabis, such as sleep problems, fatigue, anorexia and depression, nausea and vomiting, but also its opioid-sparing effect. We know that opioids are not a panacea for all patients, but also we don't want people to be on opioids and benzodiazepines for prolonged periods of time, and we need other solutions for less addictive and more effective medications. I've mentioned down here a study that we've just published looking at the symptoms that people commonly present with in the supportive care space in our large comprehensive cancer centre, and we can say that the symptoms are very similar, and cannabis is being used for these clusters of symptoms, and that's a topic, a part of our ongoing research in our unit. And I thought I would evaluate my practice. And I did this 2 years ago. So after I'd been practicing and using cannabis for a while, I looked at who do I prescribe to, what are the common symptoms they present to, and what am I commonly prescribing? And in Australia, we're all quite new at this. Unlike other countries in the world, the role of prescribing has gone to the doctors. And the doctors are responsible for prescribing something they know very little about. And so I go through from first principles, which is to use a whole plant product if I can, but I also, as I have become more comfortable in prescribing, I am selecting different products for different patients according to what else they're on, their previous experience with cannabis, and their specific symptom needs. And so finding the right cannabis product, the right amount of THC, the minor cannabinoids, and having exposure to new products coming on the market will show a far more nuanced and complex selection of cannabis products and way of prescribing. Sometimes demonstrating with a case is helpful. So this was one of the first patients that I saw, and this is a 58-year-old man who had local pancreatic cancer removed by Whipple's procedure. He had lymph node positive disease, so required chemotherapy, radiotherapy. He was also a nurse educator who really helped me work out how to monitor my patients. And so he had chemotherapy-induced nausea and vomiting, but he also had nausea related to having pancreatic cancer, and that very common symptom, people have a Whipple's where they have a bypass of the pancreatic and partial removal of the pancreas, can leave them with chronic nausea and pain. And so, as with all my patients, I took a history of their presenting symptoms, past history, medication review, mental health, and ongoing. Looked at the chemotherapy that he was on, which causes a lot of nausea, capecitabine and gemcitabine in some patients. The medications he was on for his pain, for his diabetes, and for nausea, and was there anything else that I could prescribe? And what the expectations for him were for his care. That was to get through chemotherapy, make sure he stayed on chemotherapy because he had would have a good outcome, and then to get through radiotherapy. Radiotherapy to the pancreas is very horrible and causes a lot of nausea. As a young prescriber, even though I'm not so young, I needed to learn how to choose the best product that was available to me. I developed a guidance document that I give to all my patients that includes how to keep a diary, how to self-titrate, starting on the lowest dose possible and gradually increasing, what increment to increase. And I adjust this for my patients according to the symptoms, but according to their fragility. So an 88-year-old, I would suggest to prescribe to go up by very small increments, such as 0.1 mil increments at a time, compared to somebody who is a young 25-year-old who'd used cannabis all their life. So identifying the patient's vulnerabilities and setting a way of self-titrating, and then monitoring the patient over time. And I use something called the Edmonton Symptom Assessment Score, the ESAS, which scores multiple symptoms all on one page. It takes about 2 minutes to complete. And so for this patient, I monitored the nausea over time. He started radiotherapy, the nausea increased, cannabis dose increased from 0.25 mils TDS to 0.5 and up to 1 mil TDS of a 1-to-1 whole plant THC CBD product. His appetite improved and maintained good. He put on weight. Distress improved, fatigue improved with fluctuations. Other patients I commonly see would be patients such as these, and this is patients receiving hormone therapy with very severe refractory joint pain. And this is, we're also seeing this with immunotherapy patients and people with very significant joint pain that actually can't stay on their treatment because the joint pain is so severe. And this is where cannabis can improve not just the joint pain, but also the sleep. And choosing a product where people may be able to drive and have an anti-inflammatory effect, and looking at the minor cannabinoids and seeing how they can come off their treatment. Obviously, with refractory symptoms, we need to try everything else first. So for this patient, we tried mindfulness, yoga, anti-inflammatory herbs and supplements, psycho-oncology, saw the pain specialist, the rheumatologist, and so on, until we reached a point where the person just was suffering and losing weight and could not get back on hormone therapy. And so I prescribed cannabis. And in the last few minutes, I'll just touch on the research that we're doing and common refractory symptoms in advanced cancer. And so when we talk about refractory symptoms, these are symptoms that we've tried everything for, and we still can't find a way of improving these symptoms. And this is where cannabis, for me, has really been helpful. And I'm going to concentrate on nausea, anorexia, and pain. The ACRE, the centre in Newcastle, has some quite useful documents for doctors to guide them through what we commonly do as palliative care physicians for refractory symptoms in advanced cancer. And that is take the comprehensive history, try ways to reverse symptoms, and look at what else can you do to improve symptoms. And if you have tried all of those things, that's where prescribing cannabis can be really helpful. I'm involved in a study called the CARE New South Wales study, and this is cannabinoids for symptom control in advanced cancer. It's an open label prospective clinical trial. And I'm one of the CIs on this study, and we're running this study at Lifehouse. The prognosis for the patients on this study is quite difficult. It's 6 to 12 months, and it's quite difficult to get patients with that prognosis enrolled quickly. And so it's quite a challenge, but we're aiming to enroll 600 patients from around New South Wales. It's an observational study, which means it's the products that we would be prescribing for those patients and observing them over the time. The idea is to observe the effect of the range of the cannabis medicines have on 3 main symptoms of nausea, anorexia, and refractory pain, but also looking at this concept of symptom clusters. Does it improve sleep? Does it improve quality of life and well-being? And it means that we're providing compassionate access, so free access from the time they're enrolled until the time they die on the study. The other study that I was involved in, and we continue to do work in this space, is that question on does cannabis improve cancer itself, and what role does it possibly have? And then just in this last minute, I'll touch on this really interesting study with a fantastic lead investigation, Janet Schloss, and co-investigators listed here. And it was a phase 2 randomized double-blind clinical trial assessing 2 different cannabis ratios of medicinal cannabis in patients with glioblastoma multiforme. This is a very aggressive cancer, in a brain cancer, and there has been a suggestion that cannabis may actually have a role in controlling the cancer. But what we wanted to do was look at not just the cancer itself, but look at the symptoms that people suffered using a something called the FACT-BR, a tool to look at quality of life of this particular cancer group, and if they tolerated different levels of THC, so we could then go further and conduct efficacy trials. And so we looked at close to 90 patients, looking at the effectiveness of 2 different cannabis products, CBD to THC in different ratios, looking at the absorption, the safety, the dose range, and the impact on quality of life. And so as a result, we then looked at the side effects over time for this population of the 1-to-1 versus the 4-to-1 products. And we saw that the side effects improved over time. This is just a once daily dose of cannabis at night. And we saw that the main side effects were dry mouth and drowsiness, which improved over time. And we were excited to show that a single dose of THC containing medicinal cannabis was well tolerated, just 1 dose at night in recurrent glioblastoma multiforme patients. It significantly improved sleep, their functional well-being, and contentment of quality of life. And so this has enabled us to then work with our oncology colleagues and develop a program to look at, can we safely introduce a product such as cannabis that may improve the control of a cancer, but also improve the quality of life of patients. And so in this way, we're supporting the patient to improve their outcomes and their quality of life. And so the role of cannabis is incredibly exciting, as you can see, and it's a fascinating space to work in. So really, as a prescriber, it has a role for refractory symptoms. Where there's so much more to learn, but if we can keep supporting our patients and potentially look at the role of controlling cancer, it's an exciting space to work with. And thank you for inviting me to sharing some of my insights in this short period of time. Thank you.
Hi, I'm Dr. Janet Schloss, and I'm talking to you today about a trial that we conducted on medicinal cannabis and glioblastomas. Glioblastoma is a really aggressive form of brain cancer and has a survival rate of around a year to 18 months. So most people, once they're actually diagnosed, don't live for that particular long, and there's a really high recurrence rate. I mean, brain cancers in general for Australia, we have on average around 1,750 diagnosed every year, and of that around 1,000 is actually glioblastomas. So if we look at brain cancer treatment, there's been no improvement of survival rates in the last 3 decades. There's no other cancer like it. So we chose this particular one because there has been some evidence of medicinal cannabis and glioblastomas. So we particularly looked at tolerability, safety, then having an efficacy as a secondary outcome. We used 2 different forms of medicinal cannabis. One was a 1-to-1 of THC to CBD. The other one was a high THC to CBD of 4-to-1. We did MRIs at baseline and at 12 weeks. It was only 12 weeks per person, although we are actually following up on them. And we did pathology and bloods every 4 weeks. So overall, we ended up with 71 people for the actual trial, and we had a good response rate. So both forms of medicinal cannabis was really well tolerated. We had very little major side effects. We had no what's called serious adverse events of grade 3 or 4 that was actually attributable to the actual medicinal cannabis. And the main types of side effects really were like normal ones that you would come across. So your dry mouth, your dizziness, tiredness, drowsiness. So we gave them a single dose of medicinal cannabis just once a night, and that was titrated up slowly to where it was felt comfortable for them, so they could actually function normally throughout the day. So in general, for most of it, we had what's called a quality of life questionnaire, and that looked at their quality of life and all different aspects of physical, social, emotional, and functional. And what we actually found was that it was statistically significant for their physical function and their functionality. But the most important thing it actually did was actually really statistically significant for their sleep. And in this particular cohort, sleep is actually really important because they don't actually get very much. Most of them are actually on steroids, and things actually usually, their treatments usually also affect their sleep. The other thing that we actually found, I think, which is actually really important and definitely needs to be further explored, is the efficacy. So out of the trial that we did, 11% of all study participants actually had reduction in their disease. 34 actually had stable disease, which is considered very good when we're looking at recurrent or inoperable brain tumours for GBMs. So that basically means 45% actually had stable or reduction in disease. We also had 16% that had a slight flare or a slight enhancement over that 3 months, and then we had 10% who actually had progressive disease. So it gives a good basis that we are able to then look at further efficacy trials in this space. We did have a retrospective data group. However, it was actually not the best in regards to being able to compare, because a lot of them actually were Charlie Teo's patients, so they had a lot of brain surgery and they were also in a high amount of deaths. So we weren't able to really get a lot out of the retrospective data. But overall, what we do actually see, and what we actually found, was that even a single nightly dose of a THC containing medicinal cannabis was really well tolerated. It definitely improved sleep functionality and quality of life, and I think has potential to help people in their treatments and hopefully extend their length of life as well. We are actually following people up, and at this stage we have around 56 that are still alive, which is pretty amazing considering that's nearly coming up to 2 years. Thank you very much for having me today, and I'm very open to have questions. Thank you.
Good evening, everyone. My name's Dr. Jim Connell. I am a GP specialising in medical cannabis. I've had a long interest in complex and chronic disease, mental health, and palliative care, but oftentimes the treatments that I've used for these conditions have lacked efficacy or often been associated with side effects. So I have been looking for alternative treatments for my patients, and I started using cannabis as a medicine a few years ago. And I was just dabbling in medical cannabis, giving my patients the option, and found that they often were getting great results with minimal side effects. And that's really fueled my interest in cannabis and taken me down the rabbit hole. But on top of that, my own mother was diagnosed with pancreatic cancer last year, and I was privileged to be able to help her through her cancer journey by utilising cannabis medicine, and it really helped ease her suffering. She passed away in September last year, but she was smiling up until the end, and I believe that cannabis played a significant role in helping her through that journey. I'm the president of the Society of Cannabis Clinicians in Australian chapter, a fledgling society here in Australia that's dedicated towards education for Australian prescribers. I'm also the founder of Forage Medicine Lifestyle, which is a cannabis clinic that utilises cannabis alongside lifestyle interventions to upregulate the body's own endocannabinoid system to treat chronic disease. I'm involved with a company called Kin with my siblings, creating unique cannabis formulations, and we're launching in the second half of the year. And I'm also enrolled in the ACNAM Fellowship because since using cannabis as a medicine, I've seen the potential use of other complementary medicines, and I believe the integrative approach with cannabis as a medicine is probably the best way to apply cannabis. So before we go into the foundations of cannabis, just need to give a bit of background of cannabis as a medicine. So even though we've been living in an era of prohibition, cannabis has been a medicine that's been around for millennia. And the cannabis plant was thought to originate in the Tibetan Plateau about 28 million years ago, and it's spread to all corners of the globe with our human ancestors due to its importance in medicine, ceremony, and also for fibre as well. And more recently, Western doctors have been utilising cannabis as a medicine just over around 100 years ago, due to a doctor, Sir William O'Shaughnessy, from bringing hashish from India, and it was used for over 100 different conditions for almost 100 years in the 19th and 20th century. So it's only recently that we've had the cannabis prohibition, but in the 20th century, we've also had some great discoveries in regards to cannabis as a medicine. So THC was discovered in the 1960s by Raphael Mechoulam, the grandfather of cannabis, and the endocannabinoid system, the system through which cannabis exerts a lot of its effects, was discovered in the late 80s and early 90s. And it's been since discovered that all vertebrates have an endocannabinoid system, and it's essential for them as well. But over the last 20 years, cannabis as a medicine has been making a resurgence, driven from the research done in Israel and further in the USA, Canada, and more recently Australia and other countries. So before we talk about phytocannabinoids or plant-based cannabinoids, it's important to talk about the endocannabinoid system. So the endocannabinoid system is an extremely important homeostatic mechanism within the body. So it can be a circuit breaker, meaning when there's excessive stress or inflammation or pain or other aberrant processes going on within the body, the endocannabinoid system steps in and dampens down that response. It can also be a great coordinator as well. So it's almost like the conductor in a complex symphony orchestra, keeping everything in time. Without that conductor, all the systems would be firing at the wrong time, leading to imbalance. It works through a local cell signaling pathway, so it acts locally on demand as required, and it's produced from essential fatty acids from the actual cell membrane itself. But because it is something that is used on demand, if there is an excessive need placed on it, so chronic stress, chronic pain, chronic inflammation, and other autoimmune processes, then it can become depleted as well. And therefore, the body is less able to regulate disease and the disease burden becomes worse. And our understanding of the endocannabinoid system is still being enhanced every day through new research, and we're seeing that it doesn't just act with our own cells, but it communicates with the microbiome and the bacteria that live in our gut and is part of the gut-brain axis to drive inflammation and mental health conditions that can be associated with dysbiosis or an unstable microbiome of the gut. But it's there to regulate pretty much all internal processes within the body. It regulates digestion, it regulates pain, it regulates sleep, it regulates mood, and a host of other processes as well. So the endocannabinoid system is comprised of the endocannabinoids, the receptors which those endocannabinoids act upon, and also the enzymes that break them down. So the main cannabinoids being anandamide and 2-AG, but there are other cannabinoid molecules within the body, and the receptors CB1 and CB2, even though other receptors can be activated by endocannabinoids as well. These are the main ones, and CB1's main distribution is within the brain and within the central spinal cord, while CB2 is mainly in the immune cells of the body, but there is quite a wide distribution of them both, and it's a very abundant receptor in many parts of the body as well. And CB2 often you get increased expression when there's increased need for the endocannabinoid system to step in and start modulating sort of systems. So with inflammation, you'll get an increase of CB2 expression as well. And then the enzymes that break it down, they break it down inside the local cells. So this process all occurs locally where it's needed. And so it's very difficult to measure the endocannabinoid tone as well because of this. So the endocannabinoid system can be upregulated through cannabis if used correctly. If used incorrectly and in excessive amounts, it can actually start down-regulating the endocannabinoid system. But it's not just cannabis that can be utilised to harness the healing benefits of the endocannabinoid system. So exercise, especially enjoyable aerobic exercise, can upregulate this system. Things like yoga, meditation, acupuncture can all be beneficial. And then nutrition with a focus on whole foods and a diverse range of fruits and vegetables, increasing omega-3 through fish, and also certain spices can be really beneficial as well. And you'll all be happy to hear that greater than 70% Cocoa chocolate can upregulate the endocannabinoid system as well. But physical connection with those close to you and community and other enjoyable activities are all things that upregulate the endocannabinoid system. So the cannabis plant. So when we talk about cannabis, it is not all the one medicine. Cannabis is an extremely complex herbal medicine with hundreds of different active compounds broken down into cannabinoids, terpenes, flavonoids. And then when we apply heat to these compounds as well, they actually change their structure and work completely differently. So acidic are the unheated cannabinoids, and decarboxylated is once heat has been applied. The major cannabinoids that we are most commonly making our decisions around in regards to what therapies we're going to use are THC and CBD. And they are the powerhouse of the medicine, but often what dictates the mood of the medicine are the terpenes. So these can be uplifting, sedating, pain relieving, and relaxing. And then there's other minor cannabinoids as well, which we won't go into today, but they're showing real promise in certain disease states as well. So each chemovar or chemical variety or each strain is unique, and each plant is its own unique medicine. There are traditional terms for certain cannabis sort of types, being indica and sativa, but due to hybridization and crossbreeding of these plants, it's less relevant. So it's more beneficial to think of cannabis as type 1, 2, or 3 chemovars, type 1 being high CBD, type 2 being balanced, and type 3 being high THC and low CBD. So here's just a couple of pictorial wheels looking at the potential benefits of different terpenes and minor cannabinoids. When using cannabis as a medicine, the way that it is ingested changes the activity that it has within the body. So different formulations can be inhaled, they can be ingested orally, they can be absorbed through the cheeks, or they could be absorbed topically. And so if people have chronic disease symptoms, then oral is generally the best form because it gives a long sustained duration of action. And then inhaled cannabis can be used for breakthrough symptoms or when there's episodic symptoms. So if symptoms are only occurring every now and then and you want something to get on top of them quickly, then the inhaled route through a dry herb vaporizer can be very beneficial. And then there's also sprays that are absorbed through the cheeks as well. And they have slightly faster onset of action than oral and almost the same length of action as well. So going a bit deeper into the different major cannabinoids, we have delta-9 tetrahydrocannabinol, THC, and it's very similar to the body's own anandamide. So it directly stimulates the cannabinoid receptors within the body, so both CB1 and CB2. Due to its CB1 activation, it can be potentially intoxicating, but you don't need to feel intoxication to experience the therapeutic benefits of THC. So it's a very powerful medicine at low doses. And as you can see by the graph, more does not always make it more effective. So low or moderate doses are often where you get the best results. And once you actually start feeling intoxicated or getting side effects, you've often gone past the point of maximal effectiveness, and you're just likely to build tolerance if you continue dosing in that range. So what is THC used for? So THC is a very powerful analgesic. It helps with muscle relaxation and general relaxation. It can be a very powerful anti-nausea or anti-vomiting tool. It can help with appetite stimulation. It can improve sleep and slows down ruminating thoughts. It can also reduce the emotional reactivity to traumatic situations and promote positive memories as well. It does have potential lethal toxicity, but it's 1,000 times greater than the therapeutic dose. And in reality, no one has died from cannabis alone. And to ingest the amount of cannabis or THC needed to cause death, it's physically impossible. So the side effects, common side effects are red eyes, dry mouth, dizziness, a bit of memory impairment, confusion. But the most troublesome sort of symptoms can be an increase in anxiety or paranoia when you take too much THC. This is only short last though, only lasts the length of of about 8 hours, and then afterwards shouldn't cause any long-term issues. So cannabidiol is very different to THC. Cannabidiol doesn't directly interact with the cannabinoid receptors. It has a very diverse range of action. It's non-intoxicating, non-impairing, and really is like a well-tolerated shotgun in your system, activating different receptors, enzymes, and neurotransmitters. And often the more you use, the more activity it has, enhancing its potential effects as well. So one of the other benefits of CBD is it reduces the intoxicating effects of THC, so it can widen THC's therapeutic window and make cannabis medicines containing THC more tolerable. But on its own, it can be beneficial for anxiety, pain, sleep, mood. It's an anticonvulsant, it's an antioxidant. So it's a very versatile medicine, and it's generally very well tolerated, with the most common symptoms being some mild GI symptoms, a little bit of dizziness, and sometimes some fatigue as well. So accessing cannabis, a lot of people think there's a minefield in regards to accessing cannabis, but all doctors can prescribe medical cannabis. You don't need special training, but it is you'll get optimal treatment if you go through someone who has a good understanding of cannabis as a medicine. The process takes about 15 minutes. It's an online application, and it's on a per product basis, but there are authorized prescribers of cannabis medicines, and these doctors bypass the TGA application, improving time efficiency and getting medications to patients in a more timely manner. So why use cannabis in cancer and palliative care? Look, it's generally a well-tolerated medicine. It's very versatile, so you can have different products for different times of the day. You can change the combination of cannabinoids and terpenes to actually hone in on certain effects to get certain therapeutic benefits. You have different delivery routes, so you can layer the effects to have long-acting and then for breakthrough symptoms. And also if patients are having difficulty with swallowing or difficulty with inhaling, you can change the delivery route to still get a therapeutic effect with this. It also treats many components of disease at the same time, which minimizes polypharmacy or multiple medications and reducing side effects associated with this. And it also leads to better compliance because people aren't needing to take multiple pills to treat their symptoms. It can improve both mental and physical ailments. It promotes positive memories, and it can help shift the focus of the severity of the diagnosis. So it can help people with acceptance. It can help with reduction in fear, and it can build connection with loved ones as well. Also, it can make conventional treatments more tolerable, improving their efficacy as well. So people can tolerate more chemo and more radiotherapy, and it upregulates the body's own healing capacity, which is very important. And it can also protect healthy cells and tissue from collateral damage. So when you're going through chemo and radiotherapy, which indiscriminately target all cells, cannabis can help protect the healthy cells there. And there is preliminary evidence and a lot of anecdotal evidence of the anti-tumor effects of cannabinoids as well. But more research needs to be done in this area to consider using it as a primary treatment modality. But here you can see a graph of in the lab, some scientists in Israel used cannabis extracts on different cancer cell lines, and there was very varying sort of effects in regards to the tumor type and the actual cannabis type that was used in regards to how effective it was for killing cancer cells. So thank you for tuning in tonight, and thank you for listening, and I look forward to answering any questions you may have later on. Thank you. Bye.
G'day, hi there. My name is Barb Fullerton, and I head up the sales and distribution side of Little Green Pharma. And I'm here today to talk to you about, the Australian cannabis industry from seed to patient. And as Australia's first grower and producer of medicinal cannabis here in Australia, we've got some pretty good experience. So we'll get started. I can work out how to do my slides. There we go. Cool. So how many patients are actually accessing medicinal cannabis? It's a question I get asked all the time. We've seen a real incremental growth year on year. From 2018 to 2019, there was a six-fold increase. And from 2019 to 2020, there was almost a twofold increase. And in up to where we are now, we're actually sitting at around almost 100,000 patients. And once we release the March data, we'll have seen over 100,000 special access scheme approvals, which means that's the number of applications that have been made to the TGA for patients for specific conditions and a specific product. So with that number, that 100,000 number or that 99,700 number, does that mean that that's how many patients are taking medical cannabis? Not necessarily. So what it actually means is around 2/3 of that, or around 66%, are actually accessing medical cannabis. And you can estimate at any given point in time, probably about half that number are taking it now. And that's just based on some of the data that's been released over the years at different times from the TGA and Senate inquiries and those sorts of things. So what is it being used to treat? Again, this data is old, but the percentages are still the same and reflective of the SASB data that's available. So the majority of patients, probably around 71% of the applications made to the TGA are for chronic pain. So that's a broad area, or for types of pain. So that 71% includes not only chronic pain, but also includes neuropathic and other types of pain like migraine, irritable bowel disease, fibromyalgia. So that's a very broad category. If you were to add cancer pain into that number would be about 80%. Not surprisingly, cancer-related symptoms, that might include things like chemotherapy-induced nausea, vomiting, sleep, anxiety. That accounts for the next biggest chunk of special access scheme applications, followed by the psychological disorders, things like anxiety and PTSD, and then movement disorders, things like Parkinson's or multiple sclerosis, epilepsy, seizures, and sleep probably make out the last remaining. I think sleep's probably getting prescribed a little bit more with medicinal cannabis. That number is probably that percentage is probably a little bit higher than it was a couple of years ago. So if we look at the illicit access, so this data is really old, and I think that I don't know how old this number is, but this is Ian McGregor. He heads up the Lambert Initiative, which is part of University of Sydney. They were the recipients of a big grant, and they do a lot of research into medicinal cannabis, both the individual cannabinoids as well as patients. So Ian McGregor estimates there's around 100,000 Australians using illicit cannabis a few years ago. So I think that number is probably a little bit higher from what we've seen in terms of patient uptake. So the question I get asked again a lot is medical versus illicit, are they the same, right? Well, they're not really, and I think this is really important for you to understand what the difference is. The first thing is with labeling, and this is data and studies that were looked at using legal overseas supplies. So when you looked at studies done on the US market, the legal market, only 17% of those products in the US market that were sold legally were accurately labeled. So you flip that, and that's 87% of products in the US at the time of the study were inaccurately labeled. Similarly, these are products that were purchased online. So that is, let me do my quick math in my head, 31% were labeled accurately, or 69%, the majority, were inaccurately labeled. These are products purchased online. Similarly, there was some data released about the UK market, looking at CBD. So a lot of patients are looking to buy CBD online in Australia. It's actually illegal. And so something you should know about, based on the legal market in the UK, is that of those products being sold over the counter in the UK, 38% of those products, or 11 out of 29, were only 38% of those products, 11 out of 29, were accurately labeled, plus or minus 10%. So again, flipping it on its head, the majority of those products, so 62%, were inaccurately labeled in the UK. Similarly, almost 4 out of 10 of those products had less than 50% of what was on the label. So almost 4 out of 10 of those products had less than half of the active content that was stated on the label. And almost half, so 45% of those products, had measurable levels of THC. So that's particularly concerning for people who are driving here in Australia, or who are working on mines, or anywhere where there's a zero tolerance policy. So just something to be really aware of. The other thing to be cognizant of is pesticides and heavy metals in illicitly purchased medicinal cannabis. Cannabis is an unknown fact by most people, is that hemp and cannabis are both very absorbent products. It's actually used to remove the radiation from the soil in Chernobyl. And pesticides can last from after generations. So if you were to purchase seeds illegally online and grow them in their backyard, and then that plant went to seed, and you grew another plant, that one went to seed, and you grew another one, if that original seed had pesticides in it, it would still be visible and still be present generations later. So just buyer beware in terms of if you are choosing to access illicit cannabis. Another point to be made is prices have really come down a lot. So the illicit's often much more expensive than is if you were to get it prescribed by your doctor. So looking at one more example is the Pelican study. This was actually a study run by the Lambert Initiative, and it was published in 2018. And it was looking at parents that were sourcing illicit CBD for their children with uncontrolled epilepsy here in Australia. So you can imagine how careful these parents would have been when they were accessing CBD for their children with uncontrolled epilepsy. So they tested samples from 51 families. Each one of these numbers on that graph is a sample. So these on the left were perceived effective, and on the right-hand side were perceived ineffective. So this is the amount of CBD that was actually found in those products. What's concerning, there we go. So 30 out of 51 samples were perceived as effective. 13 out of 51 not effective. Of those samples, 2 had no CBD at all, had 0 CBD, and almost all of them had THC. So that's really important, again, to understand, and it illustrates the point I said before, is any illicit cannabis is highly likely to have levels of THC in it. So it's just, again, a buyer beware. So of those samples tested by this study, only 2 out of the 51, or 96%, were actually accurately labeled. So again, something to be cognizant of. So looking at, I guess, the Australian cultivation, so I can talk through Little Green Pharma and what we do here in Western Australia. So we are down here in Perth, and we grow in this little area. I'll show you exactly where. It's somewhere in that circle. So obviously, because of the Office of Drug Control, we're not able to show or tell people where we are growing, but it is in the southwest here of WA. Beautiful part of the world. The way that we grow is through mother plants or clones. So those clones are rotated out every couple months, and we take cuttings from the mother plants and replant them, find a new mother, and that's how we've been cultivating for the last three years since we first put our plants in the ground. The grow facility that we have is indoor, and we do that purposely because we're controlling not only the lighting and the humidity, but the temperature, the water and nutrients. So all of that is controlled to get the optimum amount of THC and CBD in each flower. And the average grow cycle, interestingly, is dependent on the cultivar. It's between 10 and 14 weeks. Harvest, the first time we did it, it took us about 2 days to harvest 200 plants. We have gotten much quicker with our new grow facility, and drying can take up to 2 weeks. We're looking at the moisture and the humidity. I'm speeding up because I realize I'm running out of time. We then process it, and then we send it off for its first test. TGO93, which is looking for all those things that you might find in illicit cannabis, including things like pesticides, heavy metals, aflatoxin, foreign matter. Once we get that test result back, we're able to extract if we've met the standard. And there's 2 types of extraction, CO2 and ethanol. This is our ethanol rotavat. So we're burning off the ethanol there, and it's coming down here, and then we're left with a nice resin. So then we do the extraction. That's the extraction method. Once we've gotten that nice resin at the end, we send it off for its second test. We're then looking at the THC and CBD, and including minor cannabinoids and terpenes. Once we get that result back, we're then able to manufacture. So what we're after are these little trichomes that are found on the flower. That gets turned into the resin. We add MCT oil, and you get a final product. We then send it off to its third and final test, which is plus or minus 10% of what's on the label. And then we're able to issue a TGO93 declaration to the TGA and release the product into market. So that's the manufacturing process. So how do patients access it? I would recommend that there's some really good resources online. littlegreenpharma.com have an Am I Eligible quiz, and you can see if you're likely to be eligible for medicinal cannabis. So I recommend that. If you're potentially eligible, there are resources you can take to talk to about your doctor. There's also a clinical trial we've just launched called the Quest Initiative, which offers subsidized medication. So I recommend there's also an Am I Eligible quiz there if you go to thequestinitiative.com. Or there's also Green Choices Find a Doctor, where you can find some doctors that are comfortable prescribing medicinal cannabis. And that's greenchoices.com.au. If you go to the patient drop down and find a doctor, there's also doctors. So there's 3 really good ways to find if you're eligible and then help you find a doctor. Stay up to date, so you can come to us, and if you've got questions, feel free to get in touch. And I'm sorry, Jason, I've gone a little bit over, but hope you all enjoy the rest of the talks. Thanks, guys.
Joining us now is Pamela Fraser. Now, Pamela has had a pretty bad experience with breast cancer. It had metastasized. It's always a tough word to say. And in actual fact, it looks like medical cannabis in this instance not only helped with the pain and the symptoms, but may, and that's always the key word, may have actually helped with treating the cancer itself. Hi, Pamela. Thank you for joining us.
Hello, Jason. Hi.
Now, Pamela, tell us a little bit more about your background and how you discovered that you had the breast cancer and where you got to with that, with the conventional treatments.
Yes, Jason. I was diagnosed in 2019 with breast cancer. Went through the process, had relevant surgery for a mastectomy, went through chemotherapy that didn't agree with me. So I was pulled out of that program because I was hospitalised too much. I then had a second mastectomy, thinking that all would be okay. About 7 months after that, which was August last year, I was diagnosed due to a lack of mobility that I had in fact metastasized breast cancer that's now in my bones. Was referred to a private oncologist, and he referred me to see a doctor relevant to prescribe the medicinal cannabis oil for me and how I could actually mix that with my metastasized cancer medications.
So that's a very important point that we'd sort of like to make clear to everybody who's watching, is that medical cannabis helps a lot, especially with the symptoms, but it is probably not something that you should look at using exclusively and dropping off the conventional treatments. Is that something that you would agree with?
Yes, absolutely. It's very evident that once you're diagnosed with something terminal, you tend to think a bit differently, and it really does your head in. It was evident to me that I had to stay on the metastasized cancer medication, as well as mixing it with that holistic approach of the cannabis oil.
So what were obviously pain is a significant part of cancer. Did you have any other symptoms as well as that? And how did the medical cannabis help in regards to those symptoms?
Well, I started taking the cannabis oil in August 2020 last year, and having gone through being told it was terminal and introducing the palliative care. The palliative care involved palliative radiation, so I had that. I continued to take the cannabis oil because of the pain. Even though I started in low doses, I found that as the doses increased, it took the edge off the pain, and that was bone all over. And so taking the edge off the pain, but most importantly, because of the terminal diagnosis and the mental side of what you're going through as well, that's probably the hardest part is, what next or where to from here. And I found that the cannabis oil, even up till now, I'm on the highest dose I can be on, calms my mind. It calms me to a degree where I'm not crying anymore. I'm not crying as much. I sleep better, and I'm able to get more into a positive frame of mind that I need to be in to face this journey.
What combination are you on? So medical cannabis, of course, comes in different formulations. Yeah. Are you aware of the mix that you're on?
Yes, I chose not to take the THC. I'm on the 20-to-1 mix of CBD to THC. I had a friend a long time ago, a while back, who did involve herself with the THC, and all she did was sleep a lot. Admittedly, it took all of her pain away, or a lot of her pain away. I tend to want to focus more on trying to live rather than sleep it off. So I think your threshold of pain, it's still there.
Yeah.
And I don't for a moment, I'm not saying that the purest of the cannabis oil that I'm on is actually taking the pain all away, but it's taking that edge off and it's calming me so that I can approach this journey a lot better.
Pamela, there's still something of a stigma around cannabis, and a lot of people, including myself, when I first came across it as a medicinal treatment, I was brought up to believe that this was an evil substance, and then it should say illegal. Obviously, we've all learnt a lot in the interim. How did you feel when you first came across the idea of using medical cannabis, and how have the people around you reacted?
Well, firstly, when my private oncologist referred me to this other doctor to prescribe it for me, he's very active in research in a lot of things. So that appealed to me. When I was being interviewed by that doctor for medicinal cannabis oil, I was quite surprised that it was not accepted more widely. I did a little bit of research. She was very adamant that we try this cannabis oil because I had failed in all the opioids and the general mix of pain medication. They just affected me badly. And when I started to take it and I spoke to my friends and family about it, it's actually my family that are supporting us financially as well, so that it allows me to take this to start with, because we're on a pension, so it's not as though it's something we would have gone out to do. My friends and other family members all assumed that it was like more drug-based and, oh, no, don't go there. But the more I investigated, the more I read and the more I spoke to the referring doctor, the more I understood that it was gentle. It was not going to give me symptoms like the hard medications, like all the opioids that they wanted me to take for pain. So the more I was taking the opioids, the worse I was getting medically. And it wasn't until I stopped taking those opioids and went on to the medicinal cannabis oil that I calmed down an awful lot. And that's pretty important, not only for people with, I think, chronic pain, but people who are terminal and entering the palliative care that I'm in now. It's pretty important to be calm and focused.
Absolutely. Yeah. So you've dropped off a lot of the other daily medications that you were on. Obviously, you're continuing treatment, but the medical cannabis really is primarily helping you in terms of dealing with pain and your mental state more than anything else.
For me, yes. I know that for a fact because I was hospitalised at Christmas, and the hospital put it in the too hard basket. They were going to put it away and lock it up, and we just became aware that there were doctors that really don't understand a lot about it, that we need to educate more, and the hospitals. And my husband took it home, and I was in hospital 8-9 days, and I noticed the big difference in the mental side for me. The pain was pretty bad.
Yeah.
See, this hasn't taken my pain away totally, but it's taken the edge off enough for me to get up and move around and not have to justify taking the pain meds because they're affecting my kidneys. So this is a fine balance between my metastasized cancer meds, the purest of the cannabis oil that I'm taking, and mixing those two. And God forbid, I'm not going to go off either one because I think that would be pretty silly. Yeah.
When the subject of cannabis was very first brought up to you as an option, how did you react?
I was shocked, although some of my friends told me about popping some drops under my tongue and you can buy it from here or the local greengrocer or Byron Bay or Mullumbimby. You could get it pretty readily. And to me, I'd never looked into it for a medication approach as such. So I was at an arm's length and thought, no, that's that's not for me. It wasn't until I got with someone professional that was telling me about the properties of it, how it was administered, that and the one I'm having is actually imported at the moment until it's approved here. So I was a bit shocked to start with, but then once I was advised by the professional, by the doctor herself, as to the benefits that it would have for me, not so much for the chronic pain, but that terminal aspect for me and the palliative situation I'm in, I thought, I've got to have this because it sounds like a more gentle approach for me. And I wasn't for a moment going to say no, although people have to say no at this stage. But I'm in a position where I'm really blessed to be able to take this.
Yeah, absolutely. Look, I guess one of the criticisms that people have of medical cannabis at the moment is that it is relatively expensive to get hold of. The process of getting access to it has become much easier, but it is expensive. Now, it's great that you've got people who are able to help you afford it. For a lot of other people, though, who are doing it tough, would you say that it is worth sacrificing other things just to be able to have access to it? Is it that efficacious for you that you think that it's worth prioritising it?
Absolutely. I had a conversation yesterday with the referring doctor. I mentioned I was being interviewed today by you. I just wanted to make sure that what I was going to be talking about, and even dropping her name, I don't mind doing that. It was important for me to make sure that I can, not only do I continue on with this, but I was interested to see if it's going to be, once the government do allow it in Australia, is it going to come down? Is it going to be a lot cheaper? Of course it's going to be. In the interim, for me, if it meant that my family couldn't help us financially, we were going to sell something, one of our assets, for me to do this. That's the stage we got to. Because, as I said, the chronic pain is important for a lot of people to make sure that they can get relief. The story really about the terminal side of it and the palliative side of this and the cancer is just you do anything. And that was our mindset. Hey, I've got to be on this. The more we learnt about it, this was something that we were planning on doing regardless if the family could help or not. And yes, it's costly, but when you break it down, when you go out for a meal or a cup of coffee or the extra movie or two or whatever, you do find those funds. So.
Yeah, I mean, I think you're probably aware that I'm also on the medical cannabis for my multiple sclerosis, yes. And the decision that we had to make was much the same. And in the end, we dropped Foxtel and I bought less beer. So it's probably for the best anyway.
There you go.
Pamela, thank you so much for No, please go ahead.
No. We're just very blessed to think that I have this opportunity to be able to take this product, and you guys need so much support, and we're just very grateful to be involved, to be able to tell my story, and hopefully that will help somebody, because it's vital that we pursue this for medical reasons and for people with chronic pain, and particularly those who are terminal. Yeah. I want a bit longer longevity than what they've told me, and you're going to do anything. I'm adamant we'll continue.
Yeah. Well, thank you for your support, Pamela, and it's great to have you telling your story, because look, every single thing that we can do to get the message out there will help at least one other person. And even if it helps one person, that's a fantastic thing that we're all doing. And, I'll actually provide a reminder for everybody watching this evening that everybody that you see participating in this webinar is not paid. We're all volunteering to do it, and it's all off our own bat. So once again, Pamela, thank you for your time. It's wonderful to hear your story. You're actually looking really well. So I'm hoping that there's some other benefits coming out of it as well.
Thank you.
We will be having some Q&A
Yes,
at the end of the webinar. Are you happy to stick around and take some questions possibly a bit later on?
Yes.
Wonderful.
Yes, I am.
Once again, thank you very much. And yeah, I'll look forward to the Q&A.
You're welcome.
Hi everybody, my name's Sharlene Mavor and I'm a medical scientist and also a Director of Medical Cannabis Research Australia. I'm going to be talking to you briefly about Australian clinical trials using medicinal cannabis for cancer symptoms and palliative care. I wanted to start with talking to you about the Medical Research Future Fund. This is a fund that is facilitated through the National Health and Medical Research Council on behalf of the Australian Government Department of Health. They have offered a medicinal cannabis clinical trials grant opportunity whereby they will support clinical trials that examine the effects of medicinal cannabis for the treatment of pain, symptoms and side effects of cancer and cancer treatment in cancer patients. And what they're hoping to achieve is to build evidence base to help medical professionals make informed decisions around prescribing. So these applications closed late last year and they are now currently looking at these applications. So we're hoping that we will see the announcement of quite a number of clinical trials around cancer symptoms and medicinal cannabis. I wanted to let you know about some very exciting research that's been done in WA in the labs of Professor Marco Falasca. He's a pancreatic cancer researcher and he's been doing some really positive human pancreatic cell line work, showing that when a mixture of cannabidiol and gemcitabine is used, we're getting some good results in killing these cells. He's also moved to mouse studies and he's published a study showing that these mice with pancreatic cancer survive nearly 3 times longer if they were treated with this mix of CBD and gemcitabine. What he'd like to do is facilitate a trial whereby patients could be watched with and use this formulation and with the aim to improve survival rates. But the problem is funding. Medical Cannabis Research Australia has initiated a fundraising drive where we hope to raise funds by running a webinar on Wednesday the 12th of May. And we'll be having guest speakers including oncologists, gastroenterologists, Professor Falasca and pancreatic cancer patient advocates. And we just want to raise awareness of this research and the promise it may hold and just try and get global with this and see if we can help Professor Falasca continue this work. We also will be running a US-based webinar within 48 hours of this, and we're partnering with the Cannabis for Cancer Declaration, which is a US group. So please follow our pages on social media. And if you are at all able to, we would very appreciate donations to help with this ongoing work. I wanted to talk briefly about a New South Wales trial that's undergoing right now. It is observational trial targeting pain, cancer-related and non-cancer related, and this is being run by a drug discovery group, MedLab Clinical. So they actually had a previous pilot study where they had some very promising results showing pain reduction by 40% in metastatic cancer patients. And they were using a THC CBD buccal spray, which uses a nanotechnology to enhance drug delivery and efficacy, which bypasses the GI tract, making it more bioavailable. So their observational study is quite a large one, planning to recruit 2,000 patients. It'll be run in all states and territories, and any prescribing doctor of this product can enlist a patient in this trial. The medicine will be subsidised and patients will be followed monthly for a maximum of 12 months. If you would like to participate or know more, here is some details on the screen, and please contact the people on the number below. The next trial is the cannabis chemotherapy-induced nausea and vomiting trial. being run by Associate Professor Peter Grimmerson. Now, this has been ongoing for quite a number of years because it started as a pilot study, and they have now published those results, and they have been very promising. The preliminary results showed a significant improvement in the control of chemotherapy-induced nausea and vomiting. A quarter of the patients taking medicinal cannabis experienced no vomiting and nausea compared to 14% of those who took placebo. There were side effects, but they were rated as moderate and manageable. So they've moved into a definitive trial now whereby patients receive study drug or placebo for 3 chemo cycles, and they're looking for 170 patients across 7 hospitals in New South Wales. So this is ongoing up until the end of this year, and patients will be offered free product after the trial. So please contact the trial administrators on the details below. I will now show you a video about this particular trial and their results.
The early results are in. Medicinal cannabis can make a difference to cancer patients who suffer the grueling effects of chemotherapy. The landmark trial is halfway through recruiting patients across the country.
Harry Freeman is one of the 80 patients to receive these cannabis capsules at Chris O'Brien Lifehouse.
Anything that they offer that can make you feel better.
The 32-year-old was treated for testicular cancer, the second most common cancer among young men.
It was pretty upsetting because I was getting married in the February.
Having potent intravenous chemotherapy wasn't pleasant.
I was pretty spaced out and not well.
There is still 1 in 3 people who have vomiting and half of people who still have significant nausea despite our best anti-nausea medications.
Lifehouse has been testing the use of cannabis in a scientific study to assess its true effectiveness in providing relief.
Now, this was a placebo-controlled trial, so nobody knew who was getting what until the end.
Early results reveal they make a difference.
An extra 1 in 10 people had control of nausea and vomiting, so it improved from 14% to 25%.
Harry could tell he was taking the trial capsules during his last round of chemo.
That was definitely the best cycle out of the 3.
The capsules did cause some patients to become drowsy, dizzy, or disorientated. However,
more than 4 in 5 people said they preferred having cannabis despite some side effects.
the trial is continuing. Up to 250 patients at cancer centres across New South Wales are being recruited. Harry got married a week after his treatment and is now expecting a child.
Very lucky.
Gabriella Rogers, 9 News.
So another trial that's underway at the moment is the palliative care trial in Queensland under Associate Professor Mira Agar. They started out with a stage 1 open label trial where they're looking at using vaporised botanical flower in advanced cancer. This was in 30 patients. They were dosed 3 times a day for 7 days. So this is actually been completed, but we haven't seen those results interpreted yet. Another trial that they undertook very soon after was a stage 2 double-blind RCT, where they're looking at oral THC for anorexia in patients with advanced cancer. Now, they are looking at recruiting up to 250 patients, and they're using a sublingual pure THC tablet with a matched placebo. So they'll also be titrating doses for 7 days and staying on their highest tolerated dose for 3 more weeks. So this has been recruited up until the end of the year. So if you think this may be applicable for you, please talk to your doctor and we can contact, or you can contact the via the details on the screen. The next trial I won't discuss because Judith has already done this one. But if you did want to know more, there is a helpline and an email address that you can contact. The last trial I wanted to talk about was being run in Queensland, and this is being led by Professor Janet Hardy, and this is known as the MedCan pilot, MedCan 1 and 2 trials. It was facilitated with a $1.3 million grant from the Medical Research Futures Fund. And the pilot study, which has completed, took 21 patients, and their data is still being reviewed, but more applicable to us now is the MedCan 1 and MedCan 2 trial, because they are still recruiting. These are RCT trials, which are using a 1-to-1 THC to CBD formulation, and this will be using 144 patients from 6 hospitals. 72 will be on the active product and 72 on placebo. They will be titrated up to symptom control and then 14 more days on their stable dose. And they will measure pain, tiredness, nausea, shortness of breath, drowsiness, appetite, anxiety, depression, and general well-being. And this will be recruiting up until middle of next year. Now, the same trial with the same parameters is being run, except with the CBD. And that, once again, that is being recruited up until May next year. So if you'd like to know more, please contact the person on the screen, or you can talk to me. Thanks very much for listening to my presentation. If you would like to contact me, please email or reach out to me on social media. Thank you and enjoy the rest of the webinar.